So there are two methods for skin rejuvenation, or two main methods. The first is the non-ablative approach, where we think about dermal collagenesis. And these are the treatments where we leave the epidermis, the top layer of the skin, perfectly intact, and we're really just heating the papillary dermis, where the collagen is, to stimulate new collagen to form. These are the non-ablative devices. Aerolase has one that's called the Neo, which we have in the office and we use very frequently. And at the very end, we'll talk a little about using that device in combination with the Era, which is going to be the focus of our talk today. And then there's epidermal replenishment. And what we're talking about here is basically removing layers of the surface of the skin and then having our own body replace them with new, more youthful skin. And there are a few ways to do that. The most commonly talked about are the chemical peels, and then there are the newer ablative lasers. And chemical peels have been used for a very, very long time and certainly are effective. Basically, you're using a chemical solution to slough off dead skin, and which eventually peels off to replace it with new skin. However, peels do have some disadvantages. So particularly when we're talking about deep phenol peels, there's a risk of systemic toxicity, there's potentially a risk of scarring. Oftentimes the skin is pretty irritated after a chemical peel, and that can last for quite some time. And the depth of the treatment is relatively imprecise, especially when you compare it to our laser technologies. And it's difficult to control the depth. Additionally, it's hard to really do partial area treatments with these chemical peels, whereas we can do that with the Aerolase Era.